What if I told you that your body is showing you 10 visible warning signs of serious lung problems right now, signs you can literally see in the mirror or on your body, but you're probably dismissing them as normal aging or minor issues when they're actually urgent alerts that your lungs are failing? Right now, millions of people are ignoring visible warning signs that pulmonologists recognize instantly as indicators of respiratory decline, signs that appear weeks or months before breathlessness becomes severe, giving you a critical window to intervene before permanent damage occurs. Meanwhile, those who learned to recognize these 10 visible lung warnings caught their respiratory problems early, got proper treatment, and avoided the severe decline that could have been prevented. This isn't about symptoms you feel like breathlessness or chest tightness. This is about physical signs you can see with your own eyes, changes in your appearance, your nails, your skin, your posture, your face, that are screaming warnings about your lung health. Your body is incredibly intelligent and produces visible signals when internal systems are struggling. Lung problems create specific, recognizable physical manifestations that appear on the outside of your body, but most people never learned what these signs are or what they mean, so they miss critical opportunities for early intervention. In the next few minutes, I'm going to reveal the 10 visible lung warning signs that you can see but are probably ignoring. I'll explain exactly what each sign indicates about your lung health and why it's urgent. I'll teach you how to check yourself for these signs today. And I'll share stories of people who recognized these warnings, sought help, and prevented serious respiratory decline because they caught problems early. Your lungs might be showing you warnings right now that you're dismissing. Learning to recognize them could be the difference between early intervention that preserves function and late diagnosis that finds irreversible damage. If you've noticed changes in your appearance over recent months or years, subtle things that seem like minor aging or insignificant variations, you might be dismissing important warnings your body is giving you about your lung health. Maybe your fingernails look slightly different than they used to. Perhaps your skin color isn't quite what it was. You might have developed changes in your face or posture that you attribute to getting older. These changes feel so gradual and minor that you don't think much about them, but what if they're visible manifestations of serious lung problems that need attention now? Here's what most people don't understand about how lung problems show up in your body. Your lungs are responsible for oxygenating your blood, which then delivers oxygen to every tissue and cell in your body. When your lungs aren't functioning properly, when they're not adequately oxygenating your blood, your body responds in specific ways that create visible changes. Your skin, nails, face, posture, and other external features change in predictable patterns when lung function is impaired. Pulmonologists and respiratory specialists are trained to recognize these signs instantly, but the general public has no idea these connections exist. Most people only think about lung health when they experience obvious symptoms like severe breathlessness or chronic cough. By that time, significant lung damage may have already occurred. The visible warning signs I'm about to reveal appear much earlier, when problems are still in early stages and more reversible. Learning to recognize these signs gives you a critical advantage, the ability to detect lung problems before they become severe and to seek intervention while your lungs can still recover function. After 60, everyone should be checking themselves regularly for these 10 visible lung warnings because lung function naturally declines with age, and early detection of problems allows for early treatment that can prevent serious decline. These signs are your body's gift to you, early warning system built into your physical appearance that alerts you to problems while there's still time to address them. Ignoring these signs means missing the window for early intervention and potentially facing severe lung problems that could have been prevented. Thousands of people who learned about these visible lung warnings and checked themselves discovered early signs of problems they didn't know they had. They sought medical evaluation, received diagnoses of conditions in early stages, got treatment, and avoided the severe respiratory decline that would have occurred if they'd waited until breathlessness forced them to seek care. Early detection through visible signs literally saved their lung function and potentially their lives. Now let me reveal the 10 visible lung warning signs you can see but are probably ignoring, explaining what each one indicates and why it's urgent. Visible warning sign number 1 is clubbing of the fingernails and fingertips. This is one of the most important visible lung warnings and one that most people have never heard of. Clubbing happens when the ends of your fingers become enlarged and the nails curve downward more than normal, creating a rounded appearance. The nail bed becomes spongy when pressed. The angle where the nail meets the cuticle changes from the normal angle to a straighter or even reversed angle. Clubbing indicates chronic low oxygen levels in your blood, which causes changes in the tissues of your fingertips. It's associated with serious lung conditions including chronic obstructive pulmonary disease, lung cancer, pulmonary fibrosis, and other conditions that impair oxygenation. If you have clubbing, you need medical evaluation immediately because it indicates significant lung problems. Check your fingers right now. Look at your nails from the side. Is the angle where your nail meets your cuticle sharp like normal, or has it become straighter? Press on your nail bed. Does it feel firm or spongy? Compare your fingers to photos of normal versus clubbed fingers online. Visible warning sign number 2 is cyanosis, which is a bluish tint to your lips, fingernails, or skin. This blue color indicates that your blood isn't adequately oxygenated. Oxygen-rich blood is bright red, which gives healthy skin a pink tone. Oxygen-poor blood is darker and bluish, which shows through your skin as a blue tint, most visible in areas with thin skin like lips and fingernail beds. Central cyanosis, blueness of your lips and tongue, indicates serious oxygen deficiency and is a medical emergency requiring immediate attention. Peripheral cyanosis, blueness of your fingertips or toes, can indicate circulation problems or less severe oxygen issues but still needs evaluation. Check your lips in the mirror in natural light. Are they pink and healthy looking, or do they have a bluish or purplish tint? Check your fingernails. Is the nail bed pink, or does it look bluish? Any persistent blue tinting is a serious warning sign. Visible warning sign number 3 is pale or grayish skin color, particularly in your face. When your lungs aren't oxygenating blood properly, your skin loses its healthy pink tone and becomes pale or takes on a grayish cast. This is different from natural skin tone variations. This is a change from your normal color to a paler, less vibrant version. Your face might look dull, tired, or grayish even when you're rested. This indicates chronic inadequate oxygenation that's affecting your entire body. Compare recent photos to photos from several years ago. Has your skin color changed? Do you look paler or more gray toned than you used to? Visible warning sign number 4 is barrel chest, where your chest becomes rounded and appears larger than normal, losing the normal oval shape when viewed from the side. This happens when lungs become hyperinflated due to air trapping, which occurs in conditions like emphysema and severe chronic obstructive pulmonary disease. The chest expands and stays expanded because air is getting trapped in the lungs and can't be fully exhaled. The ribcage adapts to this chronic overinflation by changing shape. Check yourself in a mirror from the side. Does your chest appear abnormally round and protruding? Is the front-to-back dimension of your chest larger than it used to be? Has your posture changed with your shoulders seeming pulled back by chest expansion? Barrel chest indicates significant lung disease and requires evaluation. Visible warning sign number 5 is using accessory breathing muscles visible in your neck and shoulders. Normally, breathing is accomplished primarily by your diaphragm with minimal visible muscle activity. When lung function is impaired, your body recruits additional muscles in your neck, shoulders, and upper chest to help breathe. You can see these muscles visibly working, tensing and relaxing with each breath, particularly the sternocleidomastoid muscles in your neck and the trapezius muscles in your shoulders. Watch yourself breathe in a mirror or have someone observe you. Are the muscles in your neck visibly working with each breath? Do your shoulders rise dramatically with inhalation? This visible muscle recruitment indicates that your primary breathing muscles aren't adequate and you're working much harder than normal to breathe. It's a sign of respiratory distress that needs medical attention. Visible warning sign number 6 is pursed lip breathing that you're doing unconsciously. Many people with lung problems instinctively start breathing through pursed lips without realizing they're doing it. While pursed lip breathing is actually a helpful technique when done intentionally, Doing it unconsciously throughout the day indicates that your body is compensating for impaired lung function. The pursed lips create back pressure that keeps airways from collapsing. Notice how you breathe when you're not thinking about it. Are your lips pursed during exhalation? Do you automatically breathe out slowly through nearly closed lips? This unconscious adaptation indicates significant lung problems that your body is trying to manage. Visible warning sign number 7 is weight loss, particularly muscle wasting in your arms, legs, and face, without trying to lose weight. Severe lung problems increase your body's energy expenditure because breathing requires so much more effort. They also often reduce appetite and impair nutrient absorption. The combination leads to unintentional weight loss, with muscle tissue being consumed for energy. Your face may become gaunt. Your limbs may look thinner with prominent bones and tendons. Track your weight monthly. Are you losing weight without trying? Have your clothes become looser? Do you look thinner in your face and limbs? Unintentional weight loss combined with breathing problems is a serious warning requiring medical evaluation. Visible warning sign number 8 is swelling in your ankles and feet that leaves indentations when pressed. This peripheral edema can indicate that your heart is struggling to pump effectively due to lung problems. When lungs are severely diseased, they create resistance to blood flow, making your heart work harder. Over time, this can lead to right-sided heart failure, which causes fluid to accumulate in your lower extremities. Check your ankles and feet, especially at the end of the day. Press firmly with your finger for a few seconds, then release. Does an indentation remain? Is there visible swelling around your ankles? Are your shoes tighter than usual? This edema combined with breathing problems indicates serious cardiopulmonary issues. Visible warning sign number 9 is leaning forward posture, particularly sitting hunched forward with arms braced on your knees or a table. People with severe breathing difficulty instinctively adopt this tripod position because it optimally positions the diaphragm and breathing muscles, making breathing slightly easier. If you find yourself automatically sitting hunched forward, bracing yourself with your arms, especially when breathless, this indicates significant respiratory compromise. Notice your habitual postures. Do you automatically lean forward when sitting? Do you brace yourself with your arms on your thighs or furniture? Do you feel like you can't breathe well unless you're in this forward-leaning position? This postural adaptation is a visible warning of serious lung problems. Visible warning sign number 10 is distended neck veins that remain visible even when you're sitting upright. Normally, the veins in your neck are only prominent when you're lying down. If they remain distended when you're sitting or standing, it indicates increased pressure in your venous system, often due to heart strain from lung disease. Severe lung problems create back pressure that affects your heart and vascular system, causing these visible changes. Look at your neck in a mirror while sitting upright. Are the veins prominently visible and distended? Do they look like raised cords running down your neck? This jugular venous distension is a serious sign requiring immediate medical evaluation. The consequences of ignoring these 10 visible warnings are delayed diagnosis and treatment of lung problems that could have been addressed in early stages. Many people don't seek medical care until breathing becomes severely compromised, by which time significant irreversible damage may have occurred. These visible signs appear much earlier, giving you the opportunity to catch problems when they're more treatable. Now let me teach you how to systematically check yourself for these 10 visible lung warnings and what to do if you find them. Do this self-check monthly, or immediately if you're concerned about your lung health. The monthly self-check protocol takes about 10 minutes. Stand in front of a full-length mirror in good natural light. Have a hand mirror available for checking areas you can't see directly. Go through each of the 10 signs systematically. Check your fingernails for clubbing, examining the angle and pressing the nail bed. Check your lips and fingernails for any blue tinting. Assess your overall skin color in natural light. Examine your chest shape from the side for barrel appearance. Watch yourself breathe to see if accessory muscles are visibly working. Notice if you're unconsciously pursing your lips when breathing. Note your weight and any changes in muscle mass. Check your ankles and feet for swelling and indentation. Assess your typical posture and whether you lean forward habitually. Look at your neck veins while sitting upright. Document what you find. Take photos if helpful for tracking changes over time. Any concerning findings require medical evaluation. Don't diagnose yourself, but do recognize these signs as reasons to see your doctor for proper assessment. Let me tell you about Richard, a 67-year-old man who attended a health screening where a volunteer nurse noticed his fingers and asked about his lung health. Richard said he had no lung problems, just got winded sometimes, which he attributed to age. The nurse explained that Richard had significant finger clubbing, which indicated chronic low oxygen and serious lung disease. Richard had never noticed this change in his fingers and had no idea it meant anything. The nurse urged Richard to see a pulmonologist immediately. Richard made an appointment and underwent lung function testing and imaging. The tests revealed significant chronic obstructive pulmonary disease and early-stage lung cancer that hadn't caused obvious symptoms yet. Because it was caught early through recognizing the visible warning sign of clubbing, Richard was able to get treatment that addressed both conditions before they became severe. His doctors said that without this early detection, he likely wouldn't have sought care until breathing became much worse, by which time treatment options would have been more limited and prognosis poorer. Richard now checks himself monthly for all 10 visible lung warnings and has learned to be vigilant about his lung health. He credits that observant nurse with potentially saving his life by recognizing a visible sign he'd been completely ignoring. The key lesson is that these visible signs are meaningful and urgent. They're not just cosmetic changes or minor variations. They're your body's way of showing you that something serious is happening internally with your lungs. Recognizing them and acting on them can be life-saving. Pulmonologists are trained to perform thorough physical examinations looking specifically for these visible signs of lung disease. Medical literature extensively documents the clinical significance of findings like clubbing, cyanosis, use of accessory muscles, and other visible manifestations of respiratory problems. These signs have high predictive value for serious lung conditions and are considered important clinical indicators. The insider knowledge that doctors share is that many patients present with advanced lung disease when earlier diagnosis could have occurred if they or their primary care doctors had recognized visible warning signs. A simple monthly self-check for these 10 signs could catch problems months or years earlier than waiting for severe breathlessness to force medical evaluation. Here's something shocking. Research on early detection of lung disease found that visible physical signs like clubbing often appear 6 to 12 months before patients develop obvious symptoms like severe breathlessness. This means you have a potential year-long early warning window if you're checking for visible signs. The revelation is that your body is giving you advance notice of lung problems through changes you can see, but only if you know what to look for and you're actually looking. When you learn to recognize these visible lung warnings and check yourself regularly, the psychological benefits are significant. You feel empowered because you have knowledge that protects you. You feel proactive because you're monitoring your health rather than passively waiting for problems to force attention. If you find a warning sign and get early treatment because of it, you feel grateful that you caught the problem early while it's more treatable. We've covered the 10 visible lung warnings you can see but probably ignore. Finger clubbing. Blue-tinted lips or nails. Pale or grayish skin. Barrel chest. Visible accessory muscle breathing. Unconscious pursed lip breathing. Unintentional weight loss. Ankle and feet swelling. Forward-leaning posture. Distended neck veins. Each indicates serious lung problems requiring medical evaluation. The question is whether you're going to check yourself today and monthly going forward, or continue ignoring visible warnings that could lead to early detection and treatment. Right now, stand in front of a mirror and check for these 10 signs. Take 10 minutes to assess yourself systematically. If you find any concerning signs, call your doctor tomorrow for evaluation. Your lungs might be showing you warnings right now. The only question is whether you're paying attention. Check yourself today. Your early detection could prevent serious decline that's still preventable.